Ntoroko have raised concern over increasing teenage pregnancies and early marriages among flood-displaced communities, attributing the trend to poor living conditions in displacement camps. The situation affecting residents across more than 5 camps has prompted non-government organizations to organize stakeholder dialogues on health camps to provide reproductive health services and support. In the Rwenzori sub-region, we're joined by Julius Lavmanya. Julius, a very good afternoon. Let's speak about the numbers as well here. How bad is the situation, and how will these effectively handle that from escalating?
Good afternoon. The situation is not good, it isn't good at all, because Ntoroko District is one of the districts in the region of Rwenzori that is prone to natural calamities, especially floods. And whenever these people are hit by floods, they leave a number of them displaced. As I report right now, over 9,000 people are living in over 5 camps in the whole district of Ntoroko. And these people are living in camp with no any food, without any help, because the district found itself constrained. They don't have enough resources to look after those people. So the situation has now attracted the non-government organizations led by Face for Family Initiative. It is Face for Family Initiative, FHI. Yes, it has come in now to help the displaced communities. I spoke to the executive office. I had this to say on this very issue.
One of the key issues is the environment, the climate risk that lead to congestion. These houses you're seeing here, this is a church is big, but the ones you see in the background, like that small house, hosts over 10 people, a mother, a father, an adolescent, and a child. And when it gets to issues of conjugal rights, the parents don't care that they have growing young people who are also seeing and they are imitating what they are doing. So one of the causes is the people who are displaced because of floods and they are in a camp and the housing is so bad. And that's why you heard them that they were calling upon the government to give them the land so that they have proper housing. The other aspect again is the complex context, because the economic aspect is bad. There's only fishing. So the government needs to make sure that the parish development model and other economic empowerment programs also target the young girls and the young women, because they end up going for risky behaviors to earn. But very, very important, parenting, which is their responsibility, we had to bounce it back to them. Alcoholism, you saw even the people we had here, most of the people who submitted during the dialogue, most of them were even drunk by the time we started, is a very, very key issue.
Well, that is the CEO, Jack Katana, CEO of Face for Family Health Initiative, and another government organization that is trying to help working together with different development partners to help these displaced communities, the people you have seen in those camps, those houses. So they are trying to bring different stakeholders on board, religious leaders, local leaders, members of parliament, to find a solution. But the details of this very report will be coming in our Masengeje and live at 9. That's it from Ntoroko District. I return to you at the Political Command Center.
Many thanks, Julius Lavmanya.